This occurs this is aggravated due to muscle spasm. Muscle spasm is nothing but tightness of the muscle. So where we have in the shoulder muscles, mostly in the neck muscles, back muscles and the leg muscles. So we work on those muscles through manual therapy, and electrotherapy is the main thing where we use it to reduce the pain and to relieve the pain. And next one is the exercise therapy. So training and retraining is an objective in exercise therapy. So second one, next one is the neurodevelopmental therapy. So through this therapy, we will train the patients how to know the biomechanics of the body, and also how to get up and how to do their activities, how to modify the activities and everything. Next one is muscle strengthening. So those who have weak muscles, we'll train them to strengthen those muscles. And of course hand function, because most of the elders, they have difficulty in buttoning, combing and everything. So we concentrate on that and we'll be training them in that. And postural awareness. So posture is main thing. So we'll make them aware of the posture and also how to correct the posture. And balance and coordination training in standing, sitting, in all the positions, we'll train them in the balance. And then last one is the gait training, which is nothing but walking training. So we'll be teaching them how to walk, how to place the leg, and what is the distance between their both legs, how they can balance and standing and everything. All these things will be acquired through the gait training. So now I like to take you all through some session, practical session. So I hope you'll be liking this. First one is the So just think that I want you all to sit straight, okay? So take everything and be free. Have your back support properly. Though we don't have the arm support, just place your hands on your lap. Sit straight. Your neck should be straight. Your shoulder level should not stoop like this. You should be straight. And your both feet should be on the floor. So this is a good sitting posture. With this sitting posture, you will be able to work on the system or to see the mobile phones and everything. This is very good posture which will prevent your muscle spasm in the neck and the back. So this is the good muscle technique. And also you should think that something is pulling from a string is pulling from your head, top of the head. Okay, so that you can make your posture straight always. So this is the one. Next we'll move on to the exercises. Before going to the exercises, I like to make it like patients with dementia or any other problems the other patients are having, they can make their exercises very pleasant. In the sense, make it pleasurable and it should be liked by the patient and easy to implement and do it and appropriate to the level of function. This is very important. According to the ability, we should train them in the functions and make it safe, as I told you earlier, and make it aerobic. That is, the heart and lungs also should work along with the exercises. And next one is the involve the noise. This is nothing but to create some music in order to facilitate, which will facilitate the training and exercises. The last one is the touching. So touching to stimulate the eye-hand coordination. They can have the balls and they can play with the balls and they can throw the balls for the hand function, and then they can also have the squeezing balls to strengthen their intrinsic muscles of the hand, so that they can involve certain kinds of balls or toys in order to stimulate the touch and eye-hand coordination. Now let's exercise. Again, I want you all to sit straight. Simple exercise we are going to do. First one is for the neck we are going to do. Just listen to me first. You are going to just lift your head up like this and then fully down. Your chin should touch your chest. Shall we start it? Up, slowly, down, up, down, abilities. Thank you.
The process of cognition, initiation. So in Ayurveda, we believe the presence of Atma, which is called as the consciousness. So the Atma and in Manas in modern terms, which is being called as mind, has faculties which is specific in thinking, in logical analysis, in interpretation, in understanding, and also in finally forming a hypothesis of what is being learned and giving a determination. So the Atma in combination with Manas, the 5 Jnana-indriyas, the sense organs, and the 5 Karma-indriyas, the motor organs, all together helps in perception of basic understanding of knowledge, which leads to Prajna. So Prajna is an intellectual knowledge or wisdom which is being achieved, and then it is being processed into Buddhi. So Buddhi helps the Prajna in understanding the characteristic properties, the specific properties of the learned knowledge, and also in assimilating and understanding the specific understanding of each object, what it is being learned. It is then being processed into Meda and Smriti. So the learned knowledge is stored as the memory, as a stored language or what is being learned in Meda, and then it is being recalled in the form of Smriti. So Meda here stands mainly where it is the storage of the learned knowledge for a brief period of time. Meda generally specifically is defined as the learned knowledge which is being stored for a long period of time, and it is being recalled with the help of Smriti. So the process of cognition initiation takes place with the help, mainly with the help of Manas, and then leads to Prajna, the wisdom or the intellectual knowledge. So in unison of these factors, knowledge is being perceived. Intellectual knowledge or wisdom is being perceived. Elderly population, the main component which helps, which deteriorates or regresses, which brings changes in memory, is where Meda and Smriti is getting affected. So the cognitive impairment causes I would like to explain. Here there are certain causes: adverse external influences, developmental disorders, psychological and acquired diseases. So here the adverse external influences are pervasive state of an excessive use of senses, mind and knowledge, fault understanding or volitional transgression, developmental disorders, genetic disorders, lifestyle disorders, psychological emotions and mood issues, acquired post-traumatic brain injury, infectious diseases are all the prime domains, areas which causes impairment, cognitive impairment. In Ayurveda, there are two important treatment processes which they have called as Yukti Vyapashraya and Naimitika Rasayana. The Yukti Vyapashraya, which we have been doing here in Buddhi clinic, are external Ayurveda therapies, and the Naimitika Rasayana are supplementary diet regimen which we do often tell a simple home remedies for people who have cognitive impairment, mild to moderate cognitive impairment. So here are some Yukti Vyapashraya, the external therapies. The main purpose of Yukti Vyapashraya, the external therapies, helps to reduce anxiety and agitation, aids to reduce behavioral psychological symptoms, and then improve sleep pattern. So we have therapies here which helps in reducing the anxiety, as I've mentioned before. Shirolekam, application of medicated paste on the scalp. Shiropichu is a cotton swab dipped in oil and kept over the forehead, over the crown, and also a small oil filling which can be applied on the crown. Sarvanga Abhyangam is the process where the oil is being applied and massaged for the full body, and Shiro Dhara is a procedure where there is a continuous streaming of medicated oil on the forehead for a brief period of time. So these are the basic Yukti Vyapashraya Chikitsa treatment which is being done at Buddhi clinic. So in speaking about the Naimitika Rasayana, as I've told before, the simple Ayurveda diet regimen promotes longevity by retarding aging process and preventing diseases. So the therapies that we have mentioned before are all being done for elderly who have dementia, who have mild to moderate cognitive changes. And with those therapies, the behavioral psychological symptoms, as I've mentioned, behavior has come down very much drastically, and we have found very good results in behavior. Now coming to simple home remedies in terms of that is preventing and reducing the effect further deterioration of cognitive impairment. Here, in Ayurveda, which we call as Kushmanda juice, or white pumpkin juice or ash goat juice, with honey for 90 days helps in arresting further deterioration in mild cognitive impairment, reduces general fatigue and mental fatigue, helps in improving keenness in sense organs, promotes sleep and improves sleep pattern. It also helps in patients who have severe anxiety and mild to moderate GERD disease. The other forms of Naimitika Rasayanam is Triphala Churnam. The contents in Sanskrit is Haritaki, Viditaki and Amalaki. In Tamil they are called as Kaduka, Tandrika and Nellika. Improves gut health. It is consumed with honey, helps in relieving constipation for elderly who have severe constipation. Then the next is the Trikattu Churna, Shunki Pipali Maricha, which is in Tamil they say as Chukku Tipali and Kurmelagu, where it helps in aid in digestion, reduces flatulence, improves peristaltic movement of the gut and improves appetite. This is also seen in elderly population who have digestive issues, and we do tell them to take the simple home remedies. It is being taken with buttermilk. Black salt, the last, which is also a carminative and digestive, which is being taken with buttermilk. These are preventive regimen for elderly. The Ashwagandha and Amalaki are considered as the nervine tonic and metabolic. It helps to reduce anxiety, improve sleep and maintains gut health. Ashwagandha boiled in milk is being prescribed generally for elders who have fatigue, tiredness in cases of cognitive impairment. Amalaki crushed and cooked with jaggery is also being prescribed. Lashun, garlic, 2 pounds boiled in 2:1 ratio of water and milk is reduced to 1 part. It helps in alleviating atherosclerotic vascular diseases in elderly. Almonds soaked in water overnight and de-skinned, removing the skin, is being taken at morning. It should be soaked in night and the skin should be removed and it is taken early morning, which is a very good preventive aspect of cognitive impairment. Recent studies and researchers have found that almonds play a very important role in arresting further deterioration in mild cognitive impairment. So here, the recent study in gut-brain axis, Ayurveda gives importance to gut health for the maintenance and normal functioning for the mind. The concept and importance of gut-brain axis was emphasized for the normal state functioning or equilibrium in physical and mental health. And also stress and anxiety and other mental health conditions have psychological consequences such as disrupting the gut health, gut mobility and functionality, which results in symptoms such as constipation. Thereby, the enteric nervous system in the gut produces serotonin, which is found to be in the recent researchers and studies, which impact mental health conditions such as stress, anxiety and depression, and it may even help in contributing to personal characteristic features. So, last but not the least, here I would like to quote a shloka in Kathopanishad and also mentioned in Bhagavad Gita. It is being said that Vedanam Samaveda Asmi, Devanam Asmi Vasavaha, Indriyanam Manascha Asmi, Bhutanam Asmi Chetana. So Lord Krishna says that among all the 5 sense organs, the mind is considered to be the king. And because without the focused attention of mind, knowledge cannot be perceived with the help of Jnanendriyas and Karmendriyas. So the mind is considered to be a 6th sense organ, which is very helpful, and it should be in the state of focused attention and concentration where knowledge can be perceived clearly. And he also says that mind should be in the state of sattva. It is then where we can acquire knowledge and understand clearly and positively. And also he says that elderly population he says that Samaveda is a treatise where it is comprising of the praise which is being sung in the in Samaveda, and it is sung about the glory of all the celestial gods, and elderly population can motivate and create confidence in their mind by reading such verses, which helps to boost them. Thank you very much for giving an opportunity.
in judgments, very poor decision making. So it could be wrong decisions or bad decisions, doesn't matter. But if you are having delays in or difficulties in decision making, in simple decision making, that is when you recognize that it is a problem. Okay, so once we recognize that we are moving across the line, we have crossed the border and it is getting problematic, what do? I think we seek professional help. And as professionals in Buddhi, what we do here is a range of treatments, including medications, therapies, like my colleague Mr. Yuvraj already made a presentation on mobility. So how mobility also provides, stimulation to the cognition is all what we do here. So as part of one of the main techniques we follow here, we practice something called cognitive retraining. So when I say retraining, the emphasis is on the word retraining. It's to help the elderly person get trained in whatever he knows. So whatever the usual activities he was doing when there is difficulty, we aid or facilitate those things to happen again. So in short, cognitive retraining only means this. So how do we do this? We do it through various modalities. We practice different activities which help them facilitate more processing in the cognition, which help them increase their attention or improve their language abilities when they have difficulty in recalling words. So many of our clients who come here, if you ask them what is this, they would rather be able to provide words like time, 4:35, but could have difficulty actually exactly pronouncing the word watch. So these are recall difficulties, they have recall difficulties. So the activities we do are focused more on helping them develop all these lost abilities or the declining abilities and all these things. One of the more favorite techniques with the elders here is the reminiscence therapy. So reminiscing, helping them remember or recall, incidents or information which was already stored and is fading away, is reminiscence therapy. So, for example, with the female clients, the more popular technique or tool we use for reminiscence is the recipe recall. So we sit with them, we talk about recipes or dishes they were, it used to be their specialities or what they were used to doing. So we ask them to list out how they will make it, what they will put it in, what is the sequencing, so what comes after what. So much of cognitive processing is involved in such simple conversations and activities, which is what we encourage and facilitate them to perform better. One more thing we do is we ask the family to give us group photographs. We show them their family main event photographs, ask them to identify who are the members and if they remember the event, what event it was, and all connected memories attached to those events. So that is something which we focus a lot on. There are also paper pen activities which we give them, which help them, process and perform some of the cognitive abilities. Okay, so this is just to give all of you a break from all the listening and attention you have been put through the last 10-15 minutes. So those who can spot at least 5 differences in probably 30 seconds, good job if you are able to do that. Those are able to identify more than 5, super good job. So yeah, we just take a breather and move in. It's one of our favorites. Okay, so okay, now we have identified where the problem is or when we identify it as problematic memory loss and we seek help, we are going through therapies. So what happens? Does it stop with that? No. So it not only stops with providing help and facilitating the client with cognitive stimulations, it moves further on to dealing with their mental health. So what is covered under this is many of the elders who go through steady, slow, gradual cognitive decline also go through a lot of mood changes and behavioral changes. So many of them come to us saying that a person who was known to be, their father who was known to be a very quiet, calm person has suddenly turned very angry, irritable, always agitated. and more confused, has slowed down. So these are all the signs to look out for which they go through. So it is up to us to understand that cognitive decline also includes mood changes and also behavioral changes. So when it comes to mood, see, a person goes through a sense of helplessness, being clueless as to what to do, sudden confusions setting in. So all this could impact their psychological health. They go through emotions like, they go through low self-confidence, feeling inadequate, feeling insecure, not knowing what to do, getting impatient with others, all these things. So it is up to us to understand that so much is going through the elder. Okay, do we stop with the mental health of the elder person who has problems? No, we move on to the mental health of the caregiver also, which is a very, very important factor and most often not given the due recognition. So the caregiving can be very, very stressful, and what the caregiver goes through is a whole range of things. So not only physically is it very draining for the person to constantly keep looking out to the needs of the other person and everything. They may have very independent to the condition of the elder. They may have their own things happening to them. They may have their own work stress. They may be going through financial stress. They may be going through problems in their relationship and everything. So it is very imperative that we look into all these things. And when we include the caregiver, the most important aspect also is to provide education about the illness or the condition or whatever the client is or the patient is going through. So psychoeducation we call it, or educating the caregiver on what to expect, what not to expect, how to set realistic goals, how to not expect certain things from the patient is all what we cover here, and what contributes or goes a long way in dealing with the person very effectively. Okay, some takeaways probably as to what we need to keep at the top of our mind when we are dealing with an elderly person going through probably cognitive decline or mood changes, behavioral aspects. So understand that a routine, making clockwork routines really helps the client. So doing the same set of things at the same time or in the same sequence, keeping objects, things in the same place, not moving around the furniture too much, or not the orientation of the things at home. If there are minimum changes, it makes the other person more comfortable, because familiarity brings in more comfort to the person who is going through already a period of confusion as to what he is dealing with. So when you schedule their activities, please time it wisely. Make sure it's at the appropriate time, or when the person feels at his best, when his moods are very good, when he has a lot of energy to do it, not during his nap time. The other thing is, don't pile up things, or most of us have this urge to keep them engaged through the day. But what needs to be remembered is, like any normal person, they need to have their own period of doing nothing, lazing around, taking their naps, dozing off, and all those things. So please time it wisely. That is very important. Involving the person and whatever activities we do, that is also very important. Suppose I am cooking at home and I am doing my own set of chores, it's good to involve the other person, interact with them during those small time tasks, like hold this, or please pour the water in the vegetables, or keep them inside this bag, put them inside the fridge. Simple things, involving them with whatever we do, whatever conversation we are making with others. All this makes a lot of difference for the person and the processing which happens inside the person. The most important is provide choices. So one common mistake most of the caregivers or family members dealing with a person who's already going through a little bit of forgetfulness is constantly asking, na yaar theriyada, in per enna, idu yaar vandirka solunga. Those kind of questions are very, very annoying, and it kind of makes the client feel more clueless and helpless, and hence more confused. So provide choices. The best way to pose a question is always to give them multiple choices. Like, what did you eat is a direct question which they may not be able to respond directly because they have difficulty in recalling the word or the name of the food they ate. So if you're going to ask them, did you have idli or dosa? It's much easier, so make it simple and easy. Break down all the complexities in whatever you are making them do. I'm sure they'll be very successful in doing it and also end up feeling happy. That is the more important thing. A person completing a task is not as important as making them feel that they can do this, they can, probably complete it. So the other things are all the simple ones. Reduce distractions, not much of stimuli. Don't offer too many things and ask them to choose one thing. They may not be able to focus because attention is already a problem. And offer a lot of reassurance, encouragement. Be patient with them, which is very difficult. I understand for the caregiver. We lose our patience. We become irritable. But reducing our expectations and breaking it down for the client, actually, or the person, goes a long way. The other thing is, ensure you are reviewing the person regularly, in the sense, keep tab of any changes. Please get back to your physicians, maintain your consultations, drug regime, medicines, everything very regular. Okay, so what do we do for people who have not yet crossed the line into the problem area? So what some of us or most of us can do is very simple everyday things which we already are doing in a very small level, or probably not being very mindful that we are doing it, but doing it in a big way and consciously takes us a long way. So socialization, of course, it's said to improve cognition a lot. So many of the clients who come to us after a round of therapy, there is a sudden increase in their interaction levels. They bring out more words, they're willing to spontaneously initiate a sentence or words and start talking or asking about our families or whatever they remember about. So that is something which is very significant in our cognitive processing. So probably all of us can join clubs or do some group activities. If you're a person who likes going for walking, please, as far as possible, try to do it with a group, so that you're not only doing the activity but also socializing. The next thing, is physical activity. Of course, we lay a lot of emphasis on how much of physical exercise contributes to cognitive mental health. So keep moving. Anything, whatever you can do in a very small way, keep moving, because improving your cardiovascular health, providing more blood supply to your brain, oxygen to your brain, everything is going to kind of make a lot of difference. Next thing is keep yourself, new learnings. New learnings are known to, create a lot of mental stimulation. So probably learning a new song or learning a new game, something new will always, is advisable and makes a lot of difference in maintaining the activity in your brain. And nutrition, of course, there will be a lot of talk on nutrition. Of course, Dr. Dina also had included why nutrition is important. What I would like to suggest here is encourage or please practice. I think all of us should at least spend one meal a day with family members, or eating along with somebody rather than eating alone, because we eat healthier rather than when we are alone. So that is something very important. The last thing is your spiritual well-being. Please practice mindfulness, being in the moment, doing calming down activities, slowing down activities like yoga, breathing techniques, meditation, whatever. We don't have to talk about the benefits of yoga, because Dr. Vishnu will be covering that. So I think these are some of the things which all of us can start doing on a daily life basis. Thank you so much. Thank you for your attention.
Few clinical conditions can be treated by practicing these kind of yogic practices like kriyas, cleansing process, asanas, the postures, pranayamas, the breathing techniques, mudras, the gestures, and bandhas, holding or locking. Dhyana is called meditation. So with the regular practice of yoga, you will be on physical health, improves the cardio and respiratory and circulatory health, improves muscle strength and tone, maintains a balanced metabolism and gut health. On mental health, it lowers the depression and anxiety levels, improves sleep initiation and quality of sleep, and enhances the quality of life. Now I'm going to take you for a few breathing techniques with practice. So first we are going to practice Nadi Shodhana Pranayama, which is known as alternative breathing. So everybody place Chin Mudra on your left hand, keep it on your thighs, and Nashikra Mudra on your right hand. Left hand in Chin Mudra, right hand in Nashikra Mudra. Yes. Have to close your thumb, right nostril with your thumb. Inhale through your left nostril. Now close your left nostril with your ring finger. Exhale through your right nostril. Again inhale through your right nostril. Close your right nostril and exhale through your left nostril. So this makes one circle. We can go one more. Inhale through your left. Exhale through your right. Again inhale through your right. And exhale through your left. Now we can see the benefits of Nadi Shodhana Pranayama. It cleanses the pranic channels and influences the Ida and Pingla. Ida is left side and Pingla is right side. It restores the equilibrium and creates physical and mental balance and vitalizes the pranic energies. Next we are going to see Shitali Pranayama, which is called as Shingvi. So you have to roll your tongue. Inhale through your mouth and exhale through your nose. Two more rounds. While practicing this itself, you may feel the coolingness in your mouth and throat. So obviously, it will give the cooling and calming effect on your body and mind, improves your focus and reduces angry, agitations and anxiety, maintains the body temperature, maintains the vital parameter and aids in digestion. Next, we are going to do Brahmari Pranayama, which is called a humming bee technique. For that, first I will demonstrate, later on you can practice. You have to close your ears with your index finger, then take a deep inhalation. While exhaling, we have to produce humming bee sound. Let's do together. One more round. Now the benefits are it soothes the nerve, stabilizes the mood, helps in inducing deep sleep, benefits the pineal and pituitary gland by stimulating them, thus it optimizes the sleep and metabolism. Next, we are going to talk about nutrition and diet. According to naturopathy, you have to eat the solid and drink eat the liquid and drink the solid. So first we are going to see about the dry fruits juice. The benefits of dry fruit juices: it maintains a healthy heart and bone, fights against anemia and boosts hemoglobin, boosts energy, enhances the gut health and treats constipation. Next we are going to see about ashcart juice. It is rich in nutrients and cooling and alkalizing in nature, increases the energy level, improves gut health and removes acidity. Next we are going to see about lemon honey juice. It relieves cough and chest congestion, improves your immunity, reduces the inflammation, helps in digestion. Next we are going to see about the raw foods. The alkaline, it has contained the alkaline nature, helps in restoring this balance, prevents various conditions. Rich in phytonutrients and dietary fibers, improves your bowel movement. Next we are going to see about acupressure points. Acupressure is a traditional Chinese method, a technique wherein we apply a pressure on your points on your human body by using your fingers and palms. By stimulating these points, the canal gets corrected by in the meridians. So these are the few points for insomnia, stress and depression. First is G20. The way you have to locate is from the earlobe, have to make a point. The meeting point of your middle finger is G20. Given clockwise rotation for 15 times, as well the anti-clockwise rotation for 15 times in one finger. Next we are going to see heart 7. Heart 7, from your little finger side, there will be a wrist crease ending side. Have to give a press, give a rotation for 15 times clockwise and 15 times anti-clockwise. While you are doing the heart 7 and P6, you have to do for both the hands. Next is P6. From the wrist crease, this line, you have to keep 3 fingers. The end of the third finger, you have to give the stimulation. 15 times clockwise and 15 times anti-clockwise. So these points will help in quietening the mind so that you can doze off without racing thoughts, encourages your brain to release feel-good hormones like serotonin, further reducing stress that may keep you awake, stimulates and balance the sleep-inducing hormones. Thank you.
Came to us from one of the smaller towns in South India. So he had a very busy practice. He was a general physician, and he had patients coming from the nearby villages. And when the pandemic started, the family was scared that he would contract it, so they asked him to slow down his practice. And in September 2020, he had a sudden onset of behavioral issues. So he had delusions that there was somebody coming to the airport and he had to go pick them up, so that was very repetitive. He became very irritable because the family was not responding to his requests. And there were a lot of memory issues, so they found that he wasn't able to remember things that he had eaten, things that happened in the recent past, not the old memories, those were very well preserved. So he was evaluated in the place where he stayed, but then he came to us in 2021 in February. So he also had a history of hypertension and diabetes. He was on medications for that. So in our multidisciplinary assessment, we found that he had prominent behavioral and psychological symptoms. In the cognitive assessment, he had issues with memory, attention and visuospatial deficits. We also checked for language and fluency as well. And we did the imaging and we found a single strategic infarct, which kind of explained the sudden onset, and that was suggestive of a stroke. And the physical examination also picked up low back pain and spasm. So based on this multidisciplinary assessment, we put together an intensive integrative therapy plan of 40 hours. So in the Buddhi treatment paradigm, the umbrella is the allopathic medication. So we did add medicines to improve the blood perfusion to the brain. We also added Admenta, which is memantine, to improve his cognition. He continued his regular medications for hypertension and diabetes, and he was also on some supplements. So he stayed here for 2 months. And he had 20 sessions of the neuromodulation that Vivek spoke to us about, the transcranial direct current stimulation. He had 20 hours of mind lab interventions, which included cognitive retraining. Anandi worked with him, and his interest in medicine remains huge. So I also worked with him. I did 10 hours of cognitive retraining revolving around medical topics. So surprisingly, it was completely preserved. So he could really rattle off 10 causes of, let's say, breathlessness, and then he will take you through the sequence of evaluation. So like they used to do it in the past. So it was so clinical, and he used to take me through all of that. So it was a big learning experience for me as well. So there was no faltering there in any of the medical recalls. It was very good. But there were issues. So when I used to ask him, what did you have today? He'd look at his wife and say, she's the one who cooks, so how do I know what it is? So how does it matter? So those were his answers. And the CRT was done between Anandi and myself. The wife was very distressed because this was somebody who had such a good practice, and then suddenly he had nothing to do because he had not developed any hobbies. So very few leisure activities, and most of it was around keeping updated with the medical information. So at the end of this session, of these sessions, and some CAM lab session, that is Ayurveda and naturopathy treatment. So we did 10 hours of focal abhyangam, that is massages with warm medicated oil for his low back spasm and for the lower limbs. And we also did reflexology, which helps in calming down the person, so the irritability comes down to a great extent. So at the end of the 2 months, so I have a timeline because he started coming in February, and then he continues to review with us. So if you look at the A score, which is the cognitive score, it was 88, it was borderline on 100, but there were a lot of deficits in memory, and there were the irritability and delusions. So at the end of the intensive treatment program, it was 90, so he was up by 2 points, and he was more emotionally stable, the irritability had gone, and the low back pain had subsided as well. So after this, they returned home. But in the meantime, he did develop some problems with the medicine that we had given for his dementia. So we had to drop that, and we replaced it with another medicine called Aricept, that is Tonoprazole. So he went home in May, and we said we would continue the online cognitive retraining. So the challenges posed to us here was his severe hearing impairment, and he did not like to wear his hearing aid. So that was one of the issues. And there were the usual problems with connectivity and that people have in joining us online. So we used to have 30 to 45 minute sessions with him. So we did 20 of those, but you can see that the score dropped to 87. So one of the challenges the wife also had was he refused to do anything with her. So we told her you could do all these cognitive exercises at home, but then he wasn't cooperative. He said it was very kiddish, but he never told us that. So it dropped to 87. He came back to us in September last year for a review. There was again a relapse of some of the behavioral issues and restlessness. The score had gone down a little to 86, and so we proposed 10 sessions of the TDCS along with normobaric oxygen that we use at 2 liters per minute during the course of the session. And we also did the CRT again. We went back to that, but they had some situations where they had to go back. So midway they went back, and they were off therapy at least for a year, but they were reviewing in the middle. So he came back to us in August of this year. In the meantime, they had also travelled abroad to stay with their children. And in a couple of months, he wanted to come back. He got restless. He wanted to get back. So now you can see that the score has dipped significantly. It's now at 80. So all the gains that he had made during the last 1 year have disappeared because there's nothing much happening. He just continued with what he was doing. So here again, in the last 1 month, he had 20 sessions of the TDCS with the oxygen and the cognitive retraining, 10 hours. So now the score is back to 87 by 100. So what will really work for this gentleman is, I think, doing sessions in person. So we have told them to come back. And unfortunately, the medicine that we gave, again, the Aricept didn't suit him. He had some issues with that. So we had to drop that too. So we are just left with the treatments which actually have been working. And the current status is he continues to be ADL independent. He does his daily activities. The moods have been quite stable. His leisure activities, like I said, is reading medical journals. Hearing impairment continues to be a challenge. There is this repetitive speech, one of which is telling Dr. ESK and me to set up a Buddhi clinic there in his town, because he wants us to help patients like him, and he says there's no neuromodulation anywhere there. It's a small place and he'll be really happy if we could do something there. So if you look to the profile and the course of this patient's journey, I think what would have really helped is getting on with the therapy, because following an intensive therapy program, we always step them down to something smaller. So that helps maintain the gains and also improve further. So for somebody where the medicines have all fallen off, the treatments are really important, the therapies. And if the caregiver or the family could also participate and do something, we've said that there are apps, and then we've also told the children that they could facilitate that. So those would be very helpful. Now, the other thing I wanted to talk about that we didn't have a specialist presenting is the speech and language pathologist. This is a very important part of the elder care team. So all the neurodegenerative disorders like Parkinson's and stroke and dementia, lots of people have problems in swallowing. So what directly gets impacted is the intake. And once the patient is not able to eat and not able to swallow, then the person starts aspirating if the technique is faulty of feeding. So what we do very quickly initially is the patient being seen by the speech and language pathologist and teaching the family the right techniques. So the person, the specialist observes the feeding technique and then advises based on that. So we'll have to break up the feed into several times so that you're not force feeding somebody to have a large quantity in one go. So those are the things which really help. There are the techniques which can help with better feeding and prevent aspiration as well, because that can be life-threatening. So the speech and language pathologist is a very important part of the team. And the other important therapy that we do is a naturopathy treatment. That's the abdominal mud pack, which we have not spoken about. It's a very gentle, a very nice treatment where wet mud, a paste of wet mud is applied on the abdomen on a wet cloth and kept there for 20 minutes. So the science behind this is that the blood from the skin gets diverted into the internal organs. So there's better perfusion, so there's better peristalsis, so there is less reflux and the bowel movements are enhanced. So the gut health really improves, it's very gentle. And unless the person has a fever or a cold, it can be done, the mud packs can be done. So the highlights of our treatments I'd like to talk about is, especially for elder care, we take all the treatments home. At least 95% of the treatments go home. And if the patient comes to us, we see that it's done safely. We do apply oil and all that, so we see that we wipe their legs and we escort them from one room to another, so they're well taken care of. So the processes of taking care of the patient are definitely in place. There is frequent monitoring. And in elders, I think the biggest setback is intercurrent infection. And COVID has caused a lot of problems. So people with Parkinson's and with mood problems, there has been deterioration, and then we have to again work. So it's like a snake and ladder. You come down right down, and then you work again, and you do a little more therapy, and then get them back to where you were before. So if you look at the profile of patients who come to us, so we have data on 59 elders who came to us in the last 9 months. So the largest is definitely those with pain. Because of various issues, could be arthritis, could be spondylosis, could be just not enough exercise, osteoporosis, all of that. So that is around 1/3, 34%. The second largest is Parkinson's with associated problems like pain and mood problems and with cognitive impairment as well. So that is around 31%. A little smaller than the previous group is that with stroke and dementia. So if you look at the neurodegenerative alone, which are the second and the third, we have around 55%. And these people may also have the first group, so a lot of overlap between the groups. So the scales that we measure on the physical domain, we look at the VAS, which is a visual analog score, and we found that there is marked improvement after one round of therapy. And then the UPDRS is a rating scale for Parkinson's. So there is moderate improvement because the symptoms are fluctuant, and in the 15 hours of each therapy that we do, it definitely takes more time. So there is an improvement of at least 10 points in the UPDRS score on an average, but it is moderate improvement. On the WODAS, which is the disability scale, we see moderate improvement. So this is measures the cognition along with all the physical parameters. So here again it is moderate as compared to marked, because we need to do a little more beyond the intensive program. The behavioral and cognitive domain scales, we measure cognition with the ACE and the MOCA, and we have found that there is moderate improvement. And on the behavioral and psychological symptoms, we have various tests that we use. We found that there is mild to moderate improvement. So if you look at the scales, clearly the physical symptoms get better, especially the pain. So that is marked improvement, and the rest of it does take a lot of time. So this is an honest interpretation of what we have seen. The behavioral and cognitive domains need a lot more work beyond the intensive program. So it's good to stay on a step down program and keep it going. We have to give some allowance to intercurrent illnesses, like I said. So elderly are prone to get sick. They do fall down. They have surgeries, and what disturbs them a lot is bereavements. So when they lose a close family or a relative, they go back a lot. So we have to again handhold and take them through that. So if you look at the CGI is the clinical global impression, so it sums up the physical and the behavioral scales. So marked improvement is 51% have shown marked improvement, moderate improvement at 32%, minimal improvement at 15%, and we had a few patients who showed no change and who possibly got worse. I would attribute that because we know the patient profile to other illnesses that happened along the way, and they have dropped out of therapy. So a few takeaways in addition to what Anandi has said. I think she's covered most of the do's that patient's family can follow. One thing that we do when we do therapy for our patients is choosing the time correctly. So there is no point doing an interactive session like a physiotherapy or a cognitive session when the person is asleep. So we ask the family and we see to it, we have small windows with the elderly, so we see to it that we get to the patient at those times so that there is maximum impact. And we work a lot at creating rapport with the patient and the family. We work very closely with them. We see that they get comfortable. We do take care of their requirements as well. But we see to it that we don't lose focus of the patient, because very often we are told there are lots of other things happening, and we see to it that we don't get influenced by that and keep the patient in focus. I think the rest of it Anandi has covered. Now, I'm very happy to announce that we are part of this very prestigious project, which is called the VCAT. So we are working in collaboration with the Neurosciences Institute in National Neurosciences Institute in Singapore, and the Neurological Department in VHS is also part of this. So here we are testing. So VCAT is a visual cognitive assessment tool. So it uses a lot of pictures. So the objective is to see whether we are able to overcome the barriers of language and culture. So we are going to use this in the Tamil population. It is being tested in various other populations, a multinational study. So this is for people between 40 and, so elder is cognitive impairment certainly is starting at 40, starting early. So we are looking at people between 40 and 90. And you need to know Tamil because the questions are in Tamil, and we are testing it in the Tamil population obviously to see if it works as against all the other languages. And this is compared with two standardized tools, the MMSE and the MOCA, which is already being used and is accepted. So we have the details. We also have flyers which you can look at, and if you are interested, please get in touch with us. We'll be happy to screen you, and hopefully we won't find any cognitive impairment, but if there is, we are happy to tell you what to do. Thank you.
Out of the park. It's going to be a gentle, slow process of getting better, maintaining, improving and maintaining activities of daily living, improving and maintaining quality of life. Those are going to be the goals. And especially if one is suffering from memory or cognitive impairment, what is required is a sustained effort to be well. And I think that is something I'd like all of us to keep in mind. This is the Buddhi philosophy that we need harmony between modern science and ancient wisdom. You've listened to talks from across different disciplines today. All disciplines have something to offer us. And this harmonious approach, where we take the best of different systems, is very likely to be helpful to all of us. And I think this blend of modern science and ancient wisdom as a philosophy is what we feel is extremely important in elder care. And the 3 M's that we are talking about, memory, mobility, and mental health, will all benefit with this approach. If you go through this building, on one floor we have psychologists and brain stimulators. On one floor we have physical therapists, occupational therapists, speech therapists, a gym. On one floor we have Ayurveda, naturopathy, and yoga. On one floor you have the doctors doing consultations. All this is important. So it's not either or, but it's a balance of all these things as optimally put together as possible that is going to make the difference for the older person. And I think that is what I'd like all of us to focus on. One slide before. Before that. Yeah, thanks. So, today we've also done something. We've sort of talked about some data. And when you were listening to Dr. Rama, for a range of conditions, both degenerative and brain-related conditions in the older people who came to us, there was significant improvement through treatment and therapy. And I think that this is something that, we have data proof. We have used standard outcome measures, what we call clinical outcome measures for Parkinson's or for stroke or for dementia or for mental health to show that there is significant improvement. Now, here is another sample which I'd like to talk to you about. This was recently presented to an international dementia research group. It's also been presented as part of a keynote to the Chinese Dementia Research Association in Hong Kong. This was a sample of 25 people with mild cognitive impairment who all got the transcranial direct current stimulation, and they all had the holistic program. So you can see that they all had Ayurveda or naturopathy, they all had physiotherapy, yoga, they all had psychology. So they had support from different departments, as you've been hearing. And in this group of people, there was a significant improvement in the mini mental state examination score. Now, the MMSE is a very widely used tool to measure memory. Pre-treatment and post-treatment, there was a very significant improvement at the end of 8 weeks. The other table, Vivek showed it to you earlier. This is the neuropsychiatric inventory score. The neuropsychiatric inventory assesses behavioral and psychological symptoms. And again, across a range of behaviors, there was a very significant improvement pre and post treatment. Very often, when it comes to elder care, we think nothing can be done. Very often, we think that once the symptom comes, that's it. The person has to live with the symptom. But like the person that the doctor that Dr. Rama presented, there are many people who, when they make effort, are not only able to improve, they can, with sustained effort, maintain those improvements. So I think that this is something we need to keep in mind. And there's one other factor, you will see when you walk through this clinic, you will see a sign off everywhere beyond medication. Medication is important. Medication, pharmacology, and procedures, surgery, have really improved man's medical outcomes and quality of lives over the last, century. So that is not to be ever trifled with. That is important. But you can do a lot of things beyond medication to help a person who's struggling with a chronic disease. And we'd like everyone to keep that in mind, that as you get older, you are going to need this kind of support. Beyond medication, all these other things we talked about have the potential to help. I have also, since I see many young people in the room, one other thought process which I'd like to share. We live in competition. I'm an allopath. I don't believe in Ayurveda or naturopathy. I'm an Ayurveda. I don't believe in allopathy or anything else. I'm a psychologist. The only thing that helps is counseling. Nothing could be further than the truth. All these things are useful. All these things have a role to play. And rather than be in competition, we should be in collaboration. So the 3M approach is a collaborative approach, and I hope that many of you will walk away with that thought process in mind. And thank you for joining us for World Alzheimer's Day. Please remember those people who forget. I think it's very important that even if we bring one person to care, even if we change one person's life, that's a huge contribution that each and every one of us can make on World Alzheimer's Day. Thank you so much.